New South Wales has reached another vaccination milestone today. More than 70% of its residents over the age of 16 have had at least their first dose. It was a welcome glimmer of hope as the state recorded 1,288 cases and 7 deaths. Premier Gladys Berejiklian says the state is on track to reach 70% double dose coverage next month, a goalpost to ease further restrictions.
During a pandemic, we can't pretend that we're separate nations within one nation. We all need to work together. New South Wales will support the national aim to stick to the plan. I want to see as many Australians as possible across Australia, and those who are overseas join their loved ones here in Australia for a happy Christmas.
Dr Holly Seal is an infectious diseases social scientist at the University of New South Wales and our guest tonight. Welcome to the program.
Hi, hello.
More than 70% of New South Wales residents over 16 have had at least their first jab, 58% in Victoria, but that we too in Victoria are trying to reach that 70% target in September. Is it premature to be celebrating just yet?
Look, I think we take celebrations wherever we can get them right now, because certainly we do want to have some good news within these 11 a.m. press conferences. But we do also need to be realistic that certainly in the data leading up to the kind of, current period of spikes in New South Wales and in Victoria, that the ABS data was tracking at 70% of the community being positive to the vaccine and wanting to receive one. And so we knew that we would have a good shot of getting to at least 70%. Beyond that then is the groups that we need to worry about.
So you're telling me, of course we take the win, but this is the easy group.
Somewhat it was the easy group. And look, let's be fair, we've had some ups and downs with it. There has certainly been and there continues to be ongoing challenging conversations about the AstraZeneca vaccine, but certainly that the data was showing that there was this proportion of people who were willing to get some COVID vaccine, and beyond that now there's going to be slightly tougher numbers to get to, and there's certainly around about 15% of the community who, continue to show some reservation about the vaccines. And before we jump to calling them vaccine hesitant, because I'm trying to not use that word anymore in conversations, I'm trying to call them our fence sitters. We need to spend some more time talking to these groups in the population.
I want to just drill down into why you won't call them vaccine hesitant, but you want to call them fence sitters. Why?
Oh, look, at the moment I've been running these training sessions with people who are on the ground, who are having conversations with community, and to call them vaccine hesitant, it's in the media it's playing out as almost quite a negative connotation, and to call it fence sitters is to show that there is certainly, opportunity, that there is one foot planted on both sides of the fence, that they haven't, necessarily declared that they won't get vaccinated, but certainly a foot in the yes side. And that's great, because that means that they're open to some sort of discussion around, around the vaccines and around the need for vaccination, but they need support in understanding still the safety of the vaccine. And we're spending a lot of time in these training sessions talking about how to approach a conversation about, concerns around so-called long-term side effects, talking about, how do we support someone's understanding about the development of these vaccines, because these are the issues that keep coming up from what I'm hearing from community leaders and community stakeholders as being the issues that are stopping people from turning up to get a vaccine.
So how realistic is this goal of reaching 70% double dose coverage, or ideally 80% by the end of the year at this rate? I mean, it looks like New South Wales might be able to do it, then maybe Victoria, but how about the rest of the country?
Yeah, so we will see some variation and certainly some lag in bringing up, other, communities right now. And that goes back to the fact that it's not just perceptions of safety and effectiveness that, support people to go and get vaccinated, but it is also that perception about need. And so, if some people are living in regional and remote areas or parts of Australia that really, haven't been affected by COVID to date, there will continue to have this kind of sentiment that, why is it needed? is there, do I have to go and get it right now, or can I just sit and wait and watch, see what happens? But also, to reflect that, access to vaccination in some areas, still is a challenge. And I was having a conversation just prior to someone living down in Tasmania who said that they had spent hours on the phone, trying to get their teenage children a vaccine appointment and not having any luck. So that, means that we've still got access issues to work through too, as much as the thinking, feeling elements.
Oh, look, there's no doubt. I've overwhelmingly got that sentiment from people when I spend a lot of time saying get vaccinated, and people saying to me, yeah, you try. And I said, well, I know it is hard. I'm not saying for some cohorts it is hard. Yeah. What kind of a significant roadblock are we placing on people? And is that a danger spot, right? People are trying and then it's like, oh, God, it's all too hard.
Yeah, and that's frustration, and that, may make some people think, well, what's the point right now? Again, I'll just delay it. I've heard that there's more doses coming down the line in say October, November. I'll just wait until it comes, more easily. And that is certainly, in parts of New South Wales and in Sydney, we've got this kind of bunkering down community that think that they can just kind of, lay low, really reduce their activity outside and feel that then they can, wait it out. And what we've been hearing is unfortunately some of these people are still getting COVID. And I heard one instance where someone was tested positive for COVID and caught it through a click and collect activity, which you think would be the least risky compared to going into your supermarket for your shopping, but they still were, still caught COVID in that situation. So, I really think we need to get some ongoing chats with people who are in the kind of over 60 age group, the bunkering down group. And, we've been trying to develop resources to help this group, resources that help with them talking about the risk benefit profile of the vaccines, whatever vaccine, whether it be the AstraZeneca, the Pfizer vaccine or the Moderna vaccine, and try and shift this waiting and watching group.
Queensland Premier Anastasia Palaszczuk says she wants more medical advice on the implications of COVID-19 on unvaccinated kids under 12 before reopening the borders. Do you think that's necessary for the reopening of borders?
Look, I think it's certainly been echoed throughout a lot of platforms. So, as a mum of two young kids, I'm still, really, got a lot of kind of connections in with Facebook groups and other mummy platforms. And, you can see this ripple has gone through in terms of conversations about, what does COVID mean for kids? And certainly that sentiment of saying, well, hang on, if we open up, are we still putting people at risk, already, and that call is certainly true for other sectors, but focusing on kids here, and I think we've all kind of thought twice, are our kids going to be at risk if we open up? But, I think what I've been trying now to point people towards is the data coming through that, yes, kids are playing a role in transmission, and, we need to be mindful of that because, even if we open up at 70%, there's going to be adults within our communities who have only received one dose maybe or haven't even started on the journey who will be at risk. And so, kids may then be the ones to transmit it to adults. But, certainly there's no real evidence to support them having, any more severe outcomes with Delta as compared to what we were seeing with other variants previously. And they're not ending up in intensive care. So that as a parent, I'm reassured by that and, we'll keep my eye on that. And so, the Premier's kind of point around this, we don't want to be alarmist here because, a lot of parents are certainly feeling this concern right now.
586,000 people aged between 60 and 69 are yet to receive their first dose. The federal government will send letters out to that group urging them to get vaccinated, basically telling them, don't wait for Pfizer, get the AstraZeneca jab. Like, that's the story here. Yep. Is that going to work, a letter?
Oh, is it a letter? Look, we know that, nudges such as that, have played a role in the past, but, as a standalone, certainly not. It will, maybe prompt some, but, this is a group that now have had opportunity to receive a vaccine for quite a while. And so, I noticed the other day that there are other initiatives starting. I saw a help line that has started for older adults, where you can call up to ask questions about COVID and about immunisation. That helpline also has options for people who need to ask questions in another language. And so that, again, that is what we should be seeing. Beyond that, then, we've been doing a lot of work on the ground to really empower community leaders and faith-based leaders to get their conversations happening to support people too. But, I think it may be about going into community, if we know that there are people who are particularly vulnerable, who haven't received a vaccine, who have underlying health conditions, can we get some mobile teams going out to them, give them the chance to ask their questions, have that conversation, and if they opt to get the vaccine, get it to them then and there.
Thank you so much for joining us tonight.
Thank you for the time.